Welcome to this afternoon's panel. It's our second day of Emergency Management Week, which is week one of our 6-week virtual series, virtual teleconference series on building a culture of preparedness. And we had two great panels yesterday. If you missed them, you can go in and view those recordings. But today I'd like to do two things. I'd like to thank our partner for the track, the International Association of Emergency Managers. Their president, Terry Smith, participated on the latter panel yesterday. And I'd also like to thank our many sponsors. Particularly, I want to do a shout out to FedNat. They have been our educational sponsor and a great partner going forward. But today's panel is, this afternoon's panel is evaluating and sheltering during a pandemic. Couldn't be a more appropriate topic for today. And we're honored to have Kyle McPhee, who's the Director of Preparedness Programs for Hagerty Consulting, moderate the panel. And I will let Kyle introduce the rest of the folks on the panel. So without further ado, ladies and gentlemen, Kyle McPhee.
All right, terrific. Thank you so much, and thank you for the invitation to be here today and for everyone making some time to attend our session. Today's presentation is about evacuating and sheltering during a pandemic, and I'm particularly excited about the panel we've assembled, some very strong speakers. Just as a means of logistics, for additional information about our speakers, the website and the app have detailed bios and also a means of contacting the speakers directly. But I'd like to go ahead and spend a few minutes introducing the others on the panel today for the discussion. And first, I'd like to start with Jeff Byard. Jeff, with nearly 2 decades of experience in emergency management, currently serves as the Vice President of Government Relations and Emergency Management for Team Rubicon. He's a Marine Corps veteran himself and is proud to be working for an organization that's dedicated to serving communities by mobilizing veterans to help people prepare for, respond to, and recover from disasters and humanitarian crises. Prior to his current position, Jeff was the Associate Administrator for the Office of Response and Recovery at FEMA. This is the top executive charged with our nation's disaster response, recovery, logistics, and field operations. And during this time, he oversaw national level operations in the 2017 and 18 hurricane season. These were some of the largest and most complex hurricane response and recovery efforts in U.S. history. Prior to joining FEMA, Jeff served in several capacities with the Alabama Emergency Management Agency, working his way up to the Executive Operations Officer. Thanks, Jeff, for joining today. Next up is Carlos Costello. With more than 40 years experience in emergency management, Carlos currently serves as the Chief Development Officer for Tidal Basin. And prior to his current position, he was the Acting Deputy Administrator for Resilience at FEMA. And then during the Bush administration, he also served as FEMA's Assistant Administrator for Disaster Assistance, where he led the individual and public assistance programs after Hurricanes Katrina, Rita, Ike, and other disasters. Prior to FEMA, he had a 26-year career with Florida's Miami-Dade County and Fire and Emergency Services, and he concluded that with serving as the Emergency Management Director from 2003 to 2006. He also served as a Regional Disaster Officer for the South Florida Region American Red Cross, helping develop urban search and rescue response systems for the United States and internationally. Thank you, Carlos, for attending today. Next up, I'd like to welcome my colleague, Chris Thomas, who is the Recovery Manager for Hagerty Consulting. And throughout his time with the firm, he has been a leader of large and complex projects with over 7 years of concentrated experience directing FEMA-related response and recovery operations. During his current position, Chris has served 9 years prior to his current position, he served 9 years in the United States Air Force as an officer and a pilot, and as a result brings expertise in logistics, commodity management, distribution, personnel mobilization to catastrophic and complex incidents, including numerous natural disasters, national security events, and public health emergencies. And finally, I'd like to welcome Emmie Mediate, who joins us as the American Flood Coalition's Chief of Staff. Emmie collaborates with leaders across the organization to support the coalition's mission for advocating national solutions to flooding and rising sea levels. She was the lead author of the coalition's Dual Disaster Handbook, which was released in May. It's first of its kind, comprehensive resource to help local officials address the dual disaster scenario of flooding during a pandemic. She spearheaded the creation of the interactive flood funding finder tool, which simplifies the complex federal grant systems used to help under-resourced communities identify and prioritize opportunities to fund flood resilience. Prior to her current role, Emmie was also the Director of Presidential Affairs at Planned Parenthood Federation of America, and she also worked with U.S. Senator Michael Bennet and at the Baltimore City Health Department. Lastly, my name is Kyle McPhee. I'm Director of Preparedness at Hagerty Consulting. I oversee our national portfolio, planning, training, and exercise project. We support all levels of government and the private sector, and I will be the moderator for today's discussion. Just by means of setting the table and getting us all on the same page, jurisdictions across the nation, they're actively managing a co-response scenario in the face of active wildfires, hurricanes, tornadoes, an upcoming flu season, many more events that have occurred over the past weeks and months. And this is in the midst of a very complex and ongoing COVID-19 pandemic. Protection from hurricane hazards revolves around evacuation and sheltering. And typically speaking, this is a process by gathering people together and moving them to safety. In contrast, effective approaches to slowing the spread of COVID-19 are typically oriented around social distancing, community mitigation measures, stay-at-home orders, essentially separating people and keeping them apart. These two elements highlight the dilemma that we face as emergency management practitioners and as a community at large. And what this has brought to the forefront is that emergency managers and city planners across the nation need to modify their preparedness and response capabilities to adapt their efforts to account for new challenges to keep communities safe. These challenges we've already seen have facilitated opportunities for agencies and jurisdictions to work together like never before, integrating public health, volunteer organizations, the private sector, other community partners to address the demands of the pandemic amidst many other ongoing and competing priorities. That brings us to today's panel. Today, we're going to be discussing strategies and thoughts on how communities can continue to effectively navigate this environment and the ongoing challenges related to COVID-19 while also responding to day-to-day duties as well as other disasters. With that, I'd like to turn it over to our panel and first get started with Emmie. And so Emmie, turning over to you, we recognize that people are likely joining today's discussion from all different backgrounds. The American Flood Coalition, as I mentioned in your introduction, recently put out this dual disaster handbook. And if you wouldn't mind, for folks joining today's dialogue, highlight for our audience, what is the dilemma that communities face today? And what are a few key considerations that you'd recommend someone just beginning to address this topic specific to evacuations and other disasters?
Sure, thanks, Kyle. I want to start by just, I think, setting the scene so that we can all grasp just the magnitude of the dual disaster dilemma that you just described. So we've had $69 billion disasters in the last 5 years alone. And we also know that flooding is the most common and costliest of those disasters. So flooding is and has been a major challenge for communities well before COVID. And this year is not any different. You know, we all need to brush up on our Greek alphabet because this hurricane season has been so active. We've already exhausted all of the names on the Atlantic hurricane season list. And this is only the second time in history this has happened, by the way. So, you know, on top of this historical trend towards more and more flooding, more and more storms, more and more disasters, we have the threat multiplier of the pandemic. And as you said in your opening remarks, Kyle, you know, the dual disaster scenario has created an immense challenge for communities. At the American Flood Coalition, we have heard from so many of our members, from mayors, state leaders, local community groups, about the strain that this scenario has placed on their community. And a lot of local leaders are having to really kind of grapple with some difficult, unprecedented challenges. You know, how do you give evacuation orders while also encouraging physical distancing? How do you secure food supplies? How do you secure volunteers? Especially, you know, most volunteers are elderly folks who are susceptible to COVID. They might not want to raise their hand this year to help out. So there's a lot of challenges and considerations around this situation. And I know my colleagues on the panel are going to jump more into tactical examples and best practices. So I'll just kind of highlight two key considerations for now. The first is that, you know, local leaders really need to focus on the needs of vulnerable communities in disaster assessment and response. We know that due to historical inequities, vulnerable communities, and by that I mean people of color, people with low incomes, elderly communities. They bear the brunt of disaster impacts, and they face also kind of a threefold risk, if you will. First you have the baseline risk of a lower salary, underlying medical conditions. Then you have the COVID risk, a job layoff or complications with those medical conditions. And then you have the flood risk or other disaster risk. They might not have flood insurance. They might live in manufactured housing, like a mobile home. And all together, these compound risks really need to be informing the framework and the strategy around our disaster response, especially in this dual disaster scenario, because they're even more vulnerable. And then the second thing is that, there has to be coordination among different stakeholders in the community, and an emphasis specifically on communication that will reach all members of the community. Since COVID is a public health crisis, local elected officials have to be working hand in hand with local health commissioners as a critical member of that response team. And, I might be biased because I used to work at a local health department, but, I just really think that synergy is so important in any disaster response, and especially in a dual disaster scenario where COVID is such a threat. And then kind of you have the partnership with other community organizations, so churches and other community groups, as a way of amplifying the messaging and communicating the plan. And I think a really good example of that communications approach is what Leon County in Florida actually created during Hurricane Irma. They had a really robust, multi-pronged communications approach that had social media and an app and physical platforms like bulletin boards and a radio. And they were sharing hourly updates with residents. And they've continued to use this system throughout this year to tackle the dual disaster. They even put out a disaster survival guide that tackles all hazards, including COVID and flooding. So that communication is just really key. And then, just to close, I have to plug the Dual Disaster Handbook you mentioned, which we put out in partnership with the American Public Health Association in May. And that gives a lot more specific guidance informed by emergency management officials and best practices. And you can find it on our website, which is floodcoalition.org. It's free, publicly available. Just encourage anybody to use it for whom it could be helpful.
All right, great. Thank you, Emmie. And Jeff, I'm going to turn to you now just to build off of a few comments that Emmie made. So this idea that COVID-19, this dual disaster scenario, has really brought attention to potential impact on vulnerable communities, integration of traditional, non-traditional stakeholders. I think this all revolves around what is different operationally about this current environment. So with that said, the idea of evacuation because of a fire, flood, hurricane during a pandemic, it's highlighted a tremendous amount of these operational concerns or gaps in our plans. Jeff, you have extensive experience in emergency management operations, response. What do you feel are the key principles around response during COVID-19?
Yeah, Kyle, thank you. That's a great question. I think that one, the fact that we're virtual, COVID-19's here, who knows when it's not going to be here, but I think the mindset has to be moving forward that it's always here, or that type of environment. So I also don't think that you should, communities, local, state, and the federal from the government side, you still have to have those basics, right, of disaster response. What is happening? What does that mean? And now what are we doing about it to do that? As we saw in Hurricane Laura, there was a large evacuation of Southwest Louisiana. I think at the peak, they had about 20,000 residents in shelters, primarily hotels. So, the COVID has created another level of complexity to, an already complex operations. Evacuations on perfect times are not easy. They're very difficult. They can be confusing. Going off what Emmie said, you have to be able to communicate before a storm or before an impact or before, whatever that cause of that evacuation is. You have to communicate in simple terms. You have to communicate in terms that your citizens will receive it and by means in which they will receive it. Not everybody's going to go to the government, website, so to speak. How are we integrating churches and a faith-based community into the planning process for the evacuations? I think that emergency managers across the country, have that challenge. And sometimes we as emergency managers can get into this rhythm that, the world revolves around us. We're the emergency managers. That's the farthest thing from the truth. Most of the population, doesn't know their emergency manager. Most populations don't know, who to go to from that sense. But they do know their normal routines. They do know the stores they shop at. They do know the churches they attend or other civic organizations that they're a part of. And most importantly, they do know their neighbors. So, how do we, get that message down? But from the response standpoint, you're still going to respond. COVID is there. But we as a organization, when I say organization, this panel, those of us that are involved and dedicated, a large portion of our lives in helping people in disasters, COVID's not going to stop that response, and nor should it. So I think those entities also that are responding have a responsibility to the communities they're responding to, and the communities they're going back to make sure that COVID protocols are in place, social distancing, mask. I can tell you, in 104-degree temperature with 100% humidity in Southwest Louisiana, as you're cutting trees off houses or helping folks, regardless of your role, wearing a mask is a difficult task. It's one thing to wear it to the grocery store and relatively comfort, but you really have to have some discipline about yourself and about your organization when you're, in those type environments. And so, it may cause during a response an additional, safety officer on an operation. It's simply just reminding the mask discipline, the hand sanitation discipline. And then, as you're interacting, one of the things that we saw is quickly after Laura and after Sally, I was down for that. COVID is a second thought. When your house is destroyed, COVID is not a thought that you have. When you have no means to evacuate, COVID is then not a thought that you have. So, that's where we have to be aware that it's always present. It's always present in our planning factor. But I think you cannot change necessarily your process, right? What is the situation? What are you doing about it? And then, establish that footprint to deliver aid to those in need. But I will give kudos to the planning. There was a lot of, curiosity, I guess you would say, of how we were going to do evacuations, how FEMA's going to do it, how the states are going to do it. But it relatively worked, from that standpoint. But there will be situations where you have to do a congregate shelter. That's just going to be it. And even using that word, what we found is, a lot of people, when you talk about congregate, non-congregate sheltering, we should talk about, hey, we're not going to shelter in the gym. We're going to put you in a hotel. People don't understand our language, all the time. And we spend a lot of times, trying to explain that's a hurricane. What's going on the western side of our country, with all the fires. When it comes to that, life safety is primary first. So, if you've got to evacuate that quickly, you've got to weigh those risks of COVID with what's right in front of you, which is for the most part certain death. So I think emergency managers in that situation have to have a plan that's rapid, get somebody out of the area, but don't try, use as much discipline, COVID discipline as we can. In that scenario, but don't lose focus that, primary mission is life safety of what that threat right in front of you is, but also being aware and having the mental discipline to know that COVID's always around.
Great. Thank you, Jeff. So Jeff, what you described is this emergency management environment. It's built on a very strong foundation, years and years of planning, experience with evacuation, hurricane preparedness. But the one concept that might be unique to this current environment is this idea of non-congregate sheltering, or the increased emphasis on using hotels as a way of keeping people apart as they are evacuating if that is required. So Chris, I'd like to turn it over to you in this concept of non-congregate sheltering, or using hotels as one means of separating people if they do have to evacuate. Could you kind of explain that concept a little bit? And then what has some of the more recent evacuations taught us about this concept, implementing it in the field?
And thanks a lot, Kyle. So the whole concept of non-congregate sheltering is touching on points that you mentioned and Jeff mentioned as well, which is the idea and something that Emmie had talked about. There are certain vulnerable populations, and these vulnerable populations need access to shelter in the event of a disaster, whether that's a hurricane or a fire or a flood. And so how do you actually provide sheltering to vulnerable populations, or how do you allow certain individuals that are either symptomatic and so therefore presumptive positive or positive for COVID from not having access to sheltering if they need it, especially if the congregate sheltering doesn't quite have the ability to shelter those clients. So the whole concept was, how do you actually provide that kind of separation and isolation, if you will, for those individuals to be able to protect them from not just the impending disaster of either a hurricane or fire or flood, but also during a pandemic. So, started looking at hotels, dorms, and other kind of private facilities to act as shelters for this. So, again, to Jeff's point, it doesn't get away from the concept that you're still going to need the congregate shelters. You still need to stick to the basics, and really when trying to decide between the natural disaster that is impending and is probably a greater threat to those individuals and COVID-19 and the risk there, again, you have to choose the immediate and the larger threat. But at the same time, COVID's there, as Jeff was saying, and that's something that you try to plan for. And so I've seen firsthand in the state of Florida, planning began back in March for hurricane season, which didn't really kick off until the beginning of June, as most people know. Really is most active during the September timeframe. So they were really out front planning ahead on exactly what it was going to look like for non-congregate shelter. One of the first things we realized is that we didn't really get across the idea of non-congregate shelter because people were confused by that term and that nomenclature. So we started, again, getting down to the basics as far as saying, okay, this is a hotel shelter, or it's a dorm shelter, or this is a school or a community center shelter, so that people could more easily understand exactly what we were talking about. Some of the things that we saw in really getting into non-congregate shelter is whether it's a risk shelter or a host shelter. Are these community members traveling outside of their county or outside of their municipality into a county or another municipality that maybe is not in that cone of threat, and therefore getting into a host shelter, and what does that look like? And I think the concept was really built on the idea of a host shelter, mainly because these were hotels that were outside of a surge zone, and so therefore weren't really going to be part of that risk population and facility. So one of the struggles that we saw was that a lot of communities actually needed risk sheltering within the affected community. And so then it was a struggle to try and find these hotels and other kind of facilities. They were outside of a surge zone, especially in the coast. And then they also had the requisite materials and supplies and resources available to actually act as a shelter. Talking about power generation, making sure if they didn't have generators on site, that they at least had transfer switches or quick connects. Sometimes talking to the hotels or other facilities, they didn't know whether or not they had transfer switches or quick connects. And so we had to, with an impending disaster, go out there and start helping those facilities try and figure out whether or not they actually had the resources that they needed to act as a shelter. That also includes feeding and other kind of necessities. So it was, does the hotel have not just generational capacity, but also feeding? Do they have a kitchen on site or a restaurant on site? Is that capable of actually serving the need, or do you have to bring in food from outside and have a place to store it on site that's safe? And then I'd also say there's a limited access to these resources. Again, most people are going to need to get in the congregate shelters because that's what most people do. That's the basics that we were talking about. But looking at the opportunity for non-congregate shelter in hotels, In those specific facilities that met and checked off all the boxes, it was difficult to find, and so therefore there's limited access. So who do you prioritize? Do you have screening at the congregate shelters, and then those populations or households that are showing up that are possibly symptomatic, are they then transferred over, or do you stick with other vulnerable populations and pre-identify those?
Thank you, Chris. Appreciate it. Carlos, I'd like to go over to you and just kind of pick up where Chris left off. This idea of evacuation, of supporting population sheltering in place, or supporting a mass care operation, a sheltering operation, as Chris described. All of these things are tremendously resource intensive. And in a more traditional environment, a non-pandemic environment, the nation relies on mutual aid. That is the sharing of resources between jurisdictions, between states, from the federal government to help support these initiatives. In the COVID-19 environment, every jurisdiction is essentially addressing a disaster simultaneously. And then we have these surges in certain communities as they undergo a more acute incident. So describe to me, what limitations does that dynamic place on us today as we respond to these dual disasters?
Yeah, thanks, Kyle. And those are excellent points by Chris and Jeff and Emmie. I think, I'll address that. And I want to also talk a little bit about setting the stage for what we're experiencing still, in part with COVID and how it's affecting everything. We've heard the word, the adjective unprecedented to describe this. And the truth is, it is. It has been. It's the most appropriate word. For the first time in the country's history, every state, territory, the District of Columbia, and a few Indian tribes have been declared for a presidential disaster declaration. And that was just for the COVID-19 pandemic. On top of that, other disasters only compounded the challenges. We've had local jurisdictions, states, territories, and even FEMA regions at times were hesitant to release resources that were committed or could be needed at home. So the nation's recognized mutual aid system, the Emergency Management Assistance Compact, or EMAC, typically coordinates these requests for states, as you know, from states for assistance. On numerous occasions during the height of the pandemic, the response, they couldn't fill the mutual aid requests. And it's just because of that, because every community was affected, or they suspected they were going to be even more affected and unable to release these resources. We've heard, we used to say at FEMA that the most effective emergency management is locally executed, state managed, and federally supported. I think that's true when it comes to evacuations as well. The examples you listed that require different types of evacuations, wildfires and other types of sudden onset emergencies require a rapid evacuation. Excuse me. Others, such as hurricanes, typically allow for more time for pre-planning for evacuations, and it's less people that need to evacuate. So nobody's better aware of the risks, the hazards, the capabilities, and limitations of local communities and those charged with protecting it. Planning and preparedness has to focus on being self-sufficient for the risks that communities face. Keeping in mind that for the catastrophic disasters, you're going to need outside assistance. Luckily for each community, that doesn't happen all the time. I was a director of emergency management for Miami-Dade during very busy hurricane seasons. And even then, we had a lot of major disasters, but you have some time to plan. If you need resources, there was a way to get them because we weren't dealing with a pandemic at the time. Clearly, the catastrophic disasters, no community can afford to, nor does it make sense to plan to have all the resources that could possibly be needed for that. And COVID-19's taught us to take new preventive measures into account. This adds time to our planning, right? During my time at Miami-Dade, we had 2.5 million people, and at some point, almost 400,000 were in potential evacuation zones. You would never have enough shelter spaces for 400,000 people. And I'm talking about the risk shelters. Talking evacuation centers where people go. Typically, that there were public schools that had the power, the food for 3 days. There's a lot of things that Chris talked about. But there's no way you could have enough for that. And those were all inspected before and made sure that all the safety aspects were taken into account. So what do? You've got to work on making where less people have to evacuate. Primarily, for hurricanes, you evacuate because of a storm surge, right? As Max Mayfield used to say, you hide from the wind and you run from the water. If a lot of people evacuate because they feel perhaps that the wind is going to affect their home, so programs like beefing up their homes, making them hurricane shutters. We had a program at Miami-Dade for the elderly that we used mitigation funding for, that basically is a residential shuttering program. So people that were elderly under a certain level of income that would qualify for this, we were able to acquire the shutters for them, and then use our own people from the county to come and install them when it was necessary to do. So that's an example of going, addressing a vulnerable community that not only does it help them, but also helps with this equation, the balance of having enough shelter space for everyone, because you never will. So I think those are some ways that you cut down the necessity to rely on outside resources. No doubt, hopefully the pandemic, the response will be over soon, and then we won't have to deal with it. But I think a lot of things have changed because of that. Wearing masks, it becomes a culture. You wear a mask, you have one. I carry one with me in my pocket all the time, because if I'm going out, grocery store or anywhere, you need to have it. It almost becomes second nature, almost like wearing a seatbelt, right? When you first had to use it, you had to think about it. And they even had automatic seatbelts for those of us who would try to resist it. Now you don't even think about it. You put it on and you do it. So I think that's in part what we're getting towards. And we just got to incorporate that into our plans and our readiness. Thank you.
Thank you, Carlos. Jeff, over to you to pick up the conversation from there. So Carlos described an environment where there is a resource-intensive element to this dual response that we're undergoing. And one of the concepts that FEMA has promoted for quite some time is this idea of whole community, that in environments, to quote Carlos, when there's no way we'll have enough, we need to look to some of those non-traditional stakeholders to really leverage all the community's resources, capabilities, talents to solve the problem. And so when you think about this current disaster, the COVID-19 environment, and these other events that may transpire, talk to me about what experience you've had about how things have changed. What's the role of the private sector, NGOs, community-based organizations that's unique about this current time?
Yeah, I think, we talk about resource constrained and in a big disaster, how do we get whole community? I think the question is, how do we do that in every disaster? Because the private sector, what we learned, especially and whole community is a great concept. It has been around, Kyle, as you mentioned, for, quite some time. But after Hurricane Maria specifically, when I was at FEMA, Carlos was there, we really understood and got to understand the importance of the private sector. The private sector has capacity and capability and problem solving and speed to need that the government side just will never have. The government is guided, and rightfully so, by laws and regulations, which are there for good reasons. The Stafford Act being one of those major, laws that guides that. But I think that, and I hope to see coming out of COVID that we shift that mindset to say, hey, a disaster involves everyone. It's not just, the government's, responsibility. It's all of our responsibility to come together and meet those needs. And I think the private sector is well suited to do that in any scenario. They have the ingenuity, they have the capital in certain cases to rapidly develop a solution that the government may have. So, FEMA, during one of the revision of the National Response Framework, created ESF 14 that's specifically there for the private sector to get that entity engaged into what we do or what the government side does. So that's one thing. When you talk about that, though, again, I go back to how we communicate as emergency managers. To think that the private sector is going to sit down and take a bunch of ICS courses and learn, a second language to try to talk like we talk is crazy. We should throw that out the window and learn how to talk their talk, learn how to put liaisons in with what they do, and not ask the, a private sector that's doing, logistics every day to try to do it, the government way. No, we should say, hey, you do it your way. The government has a big paycheck. We'll pay for those services, but let's get it done. So that's one thing that I think that we got to move forward. And again, it goes back to, a mentality that everybody's in emergency management world. We need to get in everybody else's world to make that happen. The impacts that we're seeing in COVID across the NGOs is, and Kyle, you mentioned it a little bit, is, it's impacted our volunteer base. A lot of our volunteers at Team Rubicon, you pick the partner, they are in the at-risk category. So that is severely hurt. In some cases, some organizations more than others, the ability to do that response when it comes to that. But, when we talk about capabilities, I have to step back and hopefully we shift to a mindset that, we got over 300 million, citizens. We've got, the largest military in the world. We have tremendous capability with our private sector. When is that mentality going to shift to a truly whole community mentality? Your first responder, they do a great job, but the real first responder is your neighbor. They're going to get to you quicker than anybody. So we have to, check on each other. We have to feel needs for each other. We have to put others before self. And that's how we come out of this, and we will come out of this. But the private sector is just awesome. And we have to, at the government side, the government needs to just realize that they can do more. They can do it, when I say more, I'm looking at logistics, I'm looking at stuff, I'm looking at solutions to these complex problems. They're not going to get out and do search and rescue, a program that Carlos had just, an infinite amount of wisdom. One of the best programs out there is our USOR program. So I think there's a mix for it all, but we have to understand how each other think and how each other operate, and put more liaisons in the private sector than expecting them to come into the government side and, take the courses and learn the language.
Great. Thank you, Jeff. And Chris, over to you. So just expanding upon the environment that Jeff described, there's a lot of new players at the table, and we see this as essential to meet the demands of this co-response scenario. But if I had to really kind of objectively look at the COVID-19 response, I think there's one word that's been used maybe more than past disasters, and that's data. Data has become the language in which we're able to communicate between all the different entities engaged. And I think this has been particularly important in engaging the public health authorities and entities with the more traditional emergency responders. Can you maybe talk a little bit about data and technology and the ways that you've seen help facilitate this whole community response?
Yeah, and again, another great question, Kyle. I've been witness for over 7 months now with the Florida Division of Emergency Management, cooperating very closely with its other agencies and state departments, including the Florida Department of Health. They've been sharing a lot of information that has really allowed the state leaders and the community leaders to not only have access to this information in new and different ways, but to be able to start making decisions that are best for not just the state, but a lot of the communities to make decisions for themselves and have those decisions be informed decisions. It's also allowed the state to look at how it wants to prioritize resources by looking at the most vulnerable populations, the most impacted populations, and really all of that is data driven to be able to say, this is where we're really seeing a spike in cases, but there's other factors involved, whether it's a disaster or other kind of threats that needs or warrant special attention and therefore additional resources. And it's allowed for those communities to ask for the resources because now they know exactly what it looks like in their community and they have a better operating picture. And that is something that without the technology, without the data, without the ability to actually share that in new and unique ways, this wouldn't have happened. And again, I've been able to be at the Emergency Operations Center for the state and seen a lot of the sit reps that they do in other dashboards that at a glance, really, it's one of the best infographics that you can see that you would want, out of the private sector in advertisement. I mean, it tells you the story in a very, very quick snapshot. So I've been really impressed with that. But then the Division of Emergency Management has also partnered with the private sector, and they've gone out and sought other resources to bring to bear. And one example of that is Safer Florida. Safer Florida is a portal that actually grew out of a Salesforce-based application. This application was designed to allow those individuals, households, and clients that are in either an isolation or quarantine facility, usually in a hotel, non-congregate shelter setting, under isolation or quarantine, to be able to report out or self-identify how they're feeling, what their condition is, any needs they have, symptoms. And so it really allowed for the state and the local community leaders to be able to understand how the populations in those isolation and quarantine facilities were doing, and to be able to provide the resources necessary without necessarily having to do too much personal contact, which again, great opportunity there for data and technology driven solutions. But that was expanded upon in Safer Florida. And that is, again, a portal for those individuals that need to evacuate and seek shelter, to identify shelters either in their community or in surrounding communities, to even be able to check in to those shelters, whether it's congregate or non-congregate. It allows the community leaders, emergency managers, to be able to look at their shelters within their community to understand whether or not they're reaching max capacity, any other kind of reporting needs, other dashboards and situation reports. And then it also allows, in the instance of a non-congregate shelter at a hotel, so a hotel shelter, those hotel employees to be able to see whether they have inbound or incoming clients that need shelter, and to see any kind of special requirements that they might have, and to be able to not only check them in safely, but also check them out safely once the other threat has passed. So again, it's been an amazing, real quick jump in technology and utilizing data sharing in ways that haven't really been necessary before, but have really been driven solutions that have been required because of the pandemic.
Thanks, Chris. Great example. And this idea of Safer Florida, using data to make that connection to the general public, I think is a great launching point to the next question. So Carlos, over to you. Expanding on Chris's discussion about using data or these public-facing formats to engage the general public. Another concept advocated nationally for some time now is building this culture of preparedness within the general public. And I know today on the line, we have a lot of people who might not describe themselves as a professional first responder. They may be with an organization that supports this type of effort or is engaged in some way in a community, but they aren't from an emergency management agency. So what suggestion would you provide to non-professional first responders as they engage in COVID-19 or these dual response scenarios?
Sure, well, thank you. And I've got to start by echoing something that Jeff said. That the true first responders aren't typically fire rescue and EMS like you think. It's the people who are there, the community, everyone's there, especially for major disasters where when you call 911 and they tell you have to wait. Something that hopefully is rare, but if the professional first responders are overwhelmed, then everybody's got to be able to be there, and there's a lot of ways to prepare people. I think their life-saving training like CPR and even first aid, or even more advanced like community emergency response team or CERT training, that can help save lives for when fire and EMS are overwhelmed. I guess if there's any one positive aspect of how many disasters we've been experiencing lately, it's the fact that people realize the urgency of it. They realize that they can, and chances are will be affected by something, whether it's COVID, whether it's a hurricane coming down. You know, I mean, if you look at the hurricane map, the last one looked like a Van Gogh painting. You know, it's just, there's swirls everywhere. And so people see that, and they're more informed, they're more aware, and the community realizes that they've got to do something to prepare. That's half the battle. That's part of it. It's because sometimes the barriers you have towards preparedness, like inertia or the perception that it won't happen to them, now that's gone. You know, so that makes our job. It makes the folks responsible for coordinating that better prepared. You know, developing a culture of preparedness was goal number one in FEMA's strategic plan, and the one I was responsible for was I was there. You know, being raised in South Florida, I grew up in a culture of preparedness for hurricanes. I knew that come May and June, you'd start getting ready. You know, it also meant you might be able to get out of school because of a hurricane. But the truth is, you had that culture, you didn't even think twice about it. You know what you had to do, and you did it. And I think we're leaning more towards that. Whether it's hurricanes, a pandemic, or any other hazard, anybody can be affected, and including businesses. And businesses employ people who are directly affected. So what better incentive is there for business owners and even corporations to make sure that their people are taken care of? Not just to continue business, but it's the right thing to do. And it's the socially responsible thing to do. So that helps everyone. You know, if they're, whether they're caring for the people, making sure their people are prepared, or they're bringing what they have on a daily basis. You know, Jeff mentioned the logistics, and Chris talked about some of the data that they manage. You know, those are all things that have to happen during major disasters. They might have to happen more quickly and in larger quantities, but you know, I don't typically get my groceries from FEMA, right? What makes us think that FEMA would be good at delivering them in a disaster? You know, it's counting on what we have in the whole community that is key. You know, with COVID and the federal response, it was interesting and almost scary when the numbers were starting to come in, because it had to be data driven. The planning for having enough PPE, but especially enough ventilators. So now you're talking about a life-threatening situation that, looking at numbers early on, it not only were there not enough ventilators in the city where you were, there weren't enough ventilators in existence for what was expected to be the full impact of COVID. And without getting too much into COVID response, I mean, that's something where it was key that having accurate data that you could manage, and from the people who do it all the time, had to be incorporated into your response. Those are some of the things I think that'll carry over once we look at how much we've learned is ways to do that. Some of the things that Chris talked about that Florida DEM is doing. You know, a lot of counties, a lot of smaller areas have done a lot of things. You know, it's important to share that so that we can learn that everybody has something that they bring to the table, and especially the private sector, who does this, most of this stuff on a daily basis, and they're good at it.
Thank you, Carlos. Emmie, over to you. So Carlos had mentioned one of the benefits of having a string of very significant disasters, if you could call it that. One of the benefits of having significant disasters now since 2017, really, just one catastrophe after another, then you throw on the COVID-19 pandemic, is that the consciousness, the awareness of risk is kind of proliferating throughout communities, throughout governments. Everyone understands that emergency preparedness, disaster readiness is key. So as we sit now in the COVID-19 scenario, we've been responding for most of the year. And while there's lots of discussion about a vaccine or potentially, you know, something related to a countermeasure might be the end zone, it's also clear that there's months of response ahead of us. So as you work with the American Flood Coalition, you think about the future of communities collaborating on this dual disaster topic. What do you see both during the COVID-19 period and beyond as we look forward in emergency management?
Yeah, thanks, Kyle. And you know, I think we've all seen, and we've just heard from everyone on the panel about how, you know, there's been these unprecedented challenges, as was mentioned. And we've also seen, you know, I think it needs to be named that a lot of emergency managers have really nimbly responded, and they deserve a lot of credit for that. You know, this has been pretty unprecedented is really the word, as Carlos said, and they've responded, you know, really well to that threat. But I think as we look ahead, you know, especially since, as you mentioned, we'll be in this situation for at least a couple more months, it seems, you know, we really need to keep an eye, I think, on some of the lasting effects of the disaster, the dual disaster effect, and how it might affect communities. And, you know, the first thing I think is that COVID is placing an immense strain on local budgets. And I really do worry about, you know, we know that communities already struggle to find funding and financing for disaster response, but also resilience before the disaster even happens. And COVID has exacerbated this scenario for sure. So I think as it seems like the COVID response will continue, you know, and hurricane season lasts through November, we still have a while to go. I do worry that local communities will be left behind as they experience these long-term budget constraints. And, you know, the other thing to keep in mind is that a lot of these local communities rely on the federal funding to support their response. And, you know, as mentioned, and, you know, I'm sure Carlos knows more about this than I do, and Jeff, but FEMA is beleaguered too. You know, for the first time in US history, we had major disaster declarations in all 50 states because of COVID. And FEMA is leading the COVID response, as well as responding to hurricanes and flooding, and, you know, not to mention the wildfires that were thrown out there. So there's just this enormous strain on a system, you know, in terms of the people working, as well as the finance and the funding. And it's already an overtaxed system. So we're setting up a really tricky scenario for local community budgets. And that has follow-on effects to, you know, not just disaster response, but your day-to-day, you know, services that these governments are providing. So that does kind of concern me. And I think we need to keep an eye out for that. And then I think the second piece is, you know, relatedly, I do worry, and, you know, we've talked about this a little bit, but those vulnerable communities and the impacts there. And, you know, this plays out in a variety of ways. You know, we know that risk is distributed unevenly. I mentioned that at the very beginning, but we also know that, you know, while the long-term effects of COVID specifically remain to be seen, we have learned from previous disasters, you know, previous hurricanes, these other storms, that, you know, vulnerable populations take longer to recover. It takes them much longer to go through that recovery process. So, you know, I'm definitely concerned. Right now, we're sort of responding to the here and now, but keeping in mind, you know, what does that recovery process look like months and months down the road, particularly for those communities that take longer to bounce back from the dual disaster. But, you know, I guess the other thing is, you know, we have learned a lot, as Carlos mentioned, and this is a really good follow on from that, because COVID has really touched everyone, you know, every community down to the local level. It hasn't been isolated to a specific region or a state, which might be more similar to previous disasters. So, you know, prior to COVID, it may have been your big cities responding to a specific threat or a scenario. And now we're seeing, you know, small rural communities, every community at the same time around the country having to respond. And that's a different scenario that is kind of leading to some different lessons that we hope will inform disaster planning in the future. And, you know, I guess all of that's just to say, I do have a lot of hope. You know, I think the positive side of all of this is that because these challenges have been around a long time, you know, we've been doing disaster response for so long, we have ideas about solutions. And it's the policies that we've all already thought a lot about. I know my colleagues on the panel, you know, I'm blown away by what they've done and what they've said. They know, you know, the best practices. We've already thought about what needs to happen. I think a lot of it is just mustering the political will to solve these problems once and for all. And this is an opportunity to do that now that there's increased attention, increased awareness, and light on the issue.
Emmie, thank you. A tremendous comment and great way to wrap up our thoughts here. You know, it's clear from the panel that we can leave this discussion with some confidence. There's a tremendous amount of work that's been done, knowledge retained by professionals nationwide. And so I think we all should feel proud of the contributions made over decades to really get us to this point. Also clear that there are a number of challenges on the horizons. COVID-19 is a unique environment. There's evolving needs by the day. and we need to continue to push forward as we address those things. So thank you to the panel members for sharing your experience and insights. Great conversation. And with the last few remaining minutes, we'd like to turn it over to the audience to answer your questions. And Beth from the FAIR Foundation will lead us through that. Beth, over to you.
Thank you, Kyle. We have a couple of questions, so I'm going to read it out, and whoever wants to answer, please feel free. The first one we have is, COVID fatigue has to have taken a toll on the emergency management community. Would this affect our ability to respond to a major cat event?
I guess I can jump in here. I think it'll have an effect. I think it's not just the COVID fatigue, but I think the COVID response has a dual effect, one positive, one not so much. One is the obvious fatigue, and by now everybody's been working on it. Even if they've had breaks, they're back at it. But I think on the positive side, a lot of what's been talked about and discussed on this panel, what we've learned, the relationships that have been established, that perhaps, especially with the private sector or the non-traditional partners that you didn't think of before. I think those are things that'll help us going forward. But no doubt, the response fatigue, and then knowing that hurricanes are out there, wildfires, and there's a slew of other things that'll come up. Locusts will be next. It's just there. So I think no doubt that has an effect on what we do.
Thank you, Carlos. If no one else wants to jump in, then I'm going to move on to the next question that we have, which is, how can increasing building code standards help lower the need to evacuate ahead of a hurricane?
Okay, I'll answer that one. I think that was one of the things while I was at FEMA, one of the things that I was a big proponent of, and I saw the benefits of it in South Florida. I mean, if you don't have to evacuate your home for, speaking of a hurricane, then it's everybody wins, right? And although there's a cost savings, but more importantly, there's a life saving aspect to it, which isn't to say it's easy. There's always the argument from the builder's side that'll increase the cost of the home and everything else. The truth is the increase in cost is minimal, especially compared to the payoff, that you can be safe in your home, which is what you're most comfortable with. And aside from COVID, you're going to be most comfortable if you can make that safe. Then everybody wins like that. And in a COVID environment, now you don't have to add to the strain on the emergency management's role and responsibility to have enough shelter spaces for everyone. So everybody wins, I believe.
Yeah, and I wanted to echo that, Carlos, because again, something that Florida has done that I really like a lot is Know Your Zone, Know Your Home campaign, and they've had the Know Your Zone around for a while. People are familiar with that, whether it's a surge or flood zone, but also knowing your home and knowing whether or not your home is rated to a certain capacity to be able to withstand certain wind speeds, or whether or not it's in a threat area, and the type of housing that's available as well. Again, speaking back to a lot of us, including Emmie, that the concern is with the vulnerable populations, and to make sure that if people can stay where they are, then that's where they're going to be safest. And it's really been a big factor for this in pandemic environment when you're dealing with multiple disasters at the same time and multiple response activities at the same time.
And I'll just add on to this with, whether it's, building codes or just other efforts, I think what we do know is that there is not enough investment in mitigation more broadly. The disaster response and recovery side, those folks have borne a lot of the burden of having to deal with these different disasters that we've had. And we know that, $6 for every dollar invested, there's savings. There's a savings argument to investing more in resilience, to preparing before a storm even hits. So, there's not just building codes, there's a number of other sort of resilience efforts that we know there's underinvestment, and would save a lot of the energy, time, money on the back end as well.
Yeah, just to tag on that one a little bit. I mean, I don't think there's an emergency manager out there that would say, you know, land use planning, building codes, you know, it's going to make life easier in a disaster. You don't have to evacuate and so forth. I go back to something though that Emmie said in her closing, is it comes back to political will. I mean, you know, these measures are passed at the local level, and not just passed, but enforced at the local level. And, you know, we continue to build in flood zones daily. We continue to build, you know, structures that we know are not going to withstand hurricane force winds or other impacts and threats into the area. So, you know, I take it back to that. The emergency manager can bring in all the mitigation dollars in the world, which is great. Everybody should be a proponent of mitigation, but you know, there's got to be, laws at the local level passed and then enforced for that to you know, bear fruit. So political will.
Thank you, Jeff, and everyone who answered that question and took the time to answer some of our audience questions. Thank you to everyone who attended the panel. I just wanted to make a few announcements about the conference. If you could take the time to go to any of our exhibitor booths, you can be entered into a raffle to win AirPods Pro. So please take the time to go look at the exhibitors booths and see what some of our sponsors have to offer and some of the videos and resources that they've uploaded for our conference attendees. And I'd also like to encourage everyone to tune in again at 3 p.m. for our panel about the Fair Foundation Get Ready Broward initiative, which is a proposal to closely coordinate local governments to better identify and serve at-risk populations to prepare for catastrophic events. So hopefully we can see you all at 3, and thank you for attending.